Hey, you guys, welcome to day 26 of our March Madness practice questions. As always, I like to give my introduction and disclaimer before we get into our questions for today. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. We provide resources and tools and videos and courses to assist nurses as well as nurse practitioners with being successful on boards and in practice. We've been doing this since 2015, assisting the nursing community internationally with exam success. But I always like to give the disclaimer and reminder that there's no absolutes in medicines and we treat on a patient by patient basis. So I designed these questions on the current guidelines that are being tested on, and when I teach on certain things that we are doing in practice, I will tell you those things so there's no confusion. So, with that being said, let's get into question number one for today. All right, question number one states a patient presents to the office for follow up today. The patient complains that he continues to have a productive cough and fever since his diagnosis of pneumonia. He was seen 1 month ago and diagnosed with community acquired pneumonia. He was started on azithromycin. He has a history of hypertension. Based on these findings, how should the nurse practitioner treat? Is it A, erythromycin, B, azithromycin for 7 days, C, levofloxacin, or D, ciprofloxacin? Take a moment and tell me what you got in the comments. All right, you guys, I always tell you to read the stem of the question first to ensure that you're answering what is even being asked of you. So, the stem of the question here states based on these findings, how should the nurse practitioner treat? I always say we study assessment, diagnosis, evaluation, and treatment. Same as how we document, same as how we work with our patients. And that's the same way they score you and test you for boards. So if they're asking you, how do you treat, you need to take it back and see what the diagnosis is. How did they present for the assessment? What was the subjective? What was the objective findings, right? So here the patient came in, they're continuing to have a productive cough, a fever. They were recently diagnosed with pneumonia. States that the nurse practitioner said they had a diagnosis of community acquired pneumonia 1 month ago, and they were treated with azithromycin. So you need to start thinking through the process of how do we treat community acquired pneumonia. So azithromycin, that's a appropriate treatment as macrolides are first line therapy. But if you are having continued symptoms after being on the macrolides, you need to go to your next stages, right? So we know that macrolides are our first line therapy. Doxy can be utilized in the event of uh, allergies to macrolides, a poor response to the macrolides, and then we go to our respiratory fluoroquinolones. In the event of DRSP, patients being on antibiotics in the last 90 days, aka 3 months, or extensive comorbidities, elderly. We typically try to go to the respiratory fluoroquinolone, the big guns, to treat and knock this out. In this event, it looks as though that they're not having an adequate response to the azithromycins, and we do need to consider a respiratory fluoroquinolone. So we know we can eliminate A because that's another macrolide. B, we don't need to extend the azithromycin for 7 days. We can go ahead and eliminate that. And your best answer is C, levofloxacin, because that is a respiratory fluoroquinolone. D, ciprofloxacin is not a respiratory fluoroquinolone. Go check out my antibiotic video if you struggle with these. But as I tell you, one of my Brittany's brilliance mnemonics that I say for your respiratory fluoroquinolones is get my lungs, because we're trying to get the lungs together, right? That's what we're focusing on, the respiratory system. So get my lungs. G for get is your gemafloxacin. My, M for my, moxifloxacin, and then lungs, L for lungs, and L for levofloxacin. So C is your best answer for this situation. All right, question number two. The nurse practitioner and NP student are discussing the most common diagnostic tool to diagnose COPD. Which response shows appropriate understanding? Is it a pulmonary function test, B, spirometry, C, an incentive spirometer, or D, there isn't a standard test? Take a moment to tell me what you got in the comment. All right, stem of the question states which response shows appropriate understanding. You know, this is just a straightforward knowledge based question on what is that common diagnostic tool that is utilized to diagnose COPD. And instantly, you should be able to tell me B is spirometry, you know, so that we can look at that FEV1 and FVC, and along with the ratio of the two included to give us the percentage. So we know what category of our four gold standard stages they may be in and how to treat. All right, and question number 3 for today. It states upon assessment, the nurse practitioner notes a systolic murmur at the fifth intercostal space, mid clavicular line. She also notes a palpable thrill. Based on these findings, what type of murmur should be diagnosed? Is it A, aortic stenosis, B, aortic regurgitation, C, mitral stenosis, or D, mitral regurgitation? Take a moment and tell me what you got in the comments. All right, so step of the question states, based on these findings, what type of murmur should be diagnosed? Again, we're talking about diagnosis. We need to take a look back at the assessment. How do they present? What are the subjective objectives? So here, with the assessment, it states that the nurse practitioner notes a systolic murmur at the fifth intercostal space, mid-clavicular line, and also notes a palpable thrill. Now, y'all know, and I have a whole murmur series and questions and videos. So if murmurs are not your thing, go check that out so you can make it your thing. All right. So you can know it. But you know, I always say know the location and know systolic versus diastolic. First off, if you can identify those things, you will be able to answer the question. So systolic versus diastolic, you know, I say with systolic murmurs, the Britney's brilliance, you know, there's tons of mnemonics. So you go with whatever works best for you. But I always say men really are stupid for our sassy systolic saying, and men really being mitral regurgitation, are stupid being aortic stenosis. And so this has told us it's a systolic, it is a systolic murmur. um, but so we know it should be out of those two. So either mitral regurgitation or aortic stenosis. And then if you know the location, you'll be able to narrow it down. So aortic and mitral, right? So it says at the fifth intercostal space, mid clavicular line, we know fifth will be mitral. At the second intercostal space is aortic. So your answer here is D, mitral regurgitation. And that extra tidbit that says she notes a palpable thrill is additional information. But when you are grading a murmur, the first grade level that you note a palpable thrill is a grade 4. So if you're ever asked that or need to know that, grade 4 is where the palpable thrill is first noted. Okay. All right, you guys, I hope you found that helpful. But as always, be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial. Be sure to meet me back here. You know, we're continuing to push through our March Madness with all of our practice questions. And we have some exciting things up and coming. If you do need any assistance from us at the Nursing Studio with any of our courses, our self-paced online course, our up and coming 5-week intensive review for our FNP and AGNP reviewers, either for the ANCC or AAMP exam, that is coming on April the 8th. The last day to sign up is Friday this week, March 29th. So if you are looking to enroll, jump on it before enrollment closes, or our one-on-one sessions where we work to make your weaknesses your strength, or our most common one-on-one packages, the custom packages where we work based off of your unsuccessful results and the pretest scores, and we design a custom package to take you from being unsuccessful on boards to being successful on boards. I also have included links to our website and our paperback review book, as well as the ebook option. There are 3 links at the top of the channel. So if you're looking for those, they should give you ease of access. Um, but if you're looking for any of our services and want to see what's best for you, just shoot us a message at the nursingstudio1@gmail.com or give us a call at 803 400 6864. Happy studying. Bye, y'all.